everyone.
All right, I think we're ready to go.
All right. Thank you for joining us this evening for our Mayor's Community Town Hall. My name is Katie Donner and I work in the City Manager's office. I will be the moderator for tonight's Town Hall. I wanted to describe how tonight's meeting will go. First, all of the lines are muted, and that's simply because of the technology that we have for such a large phone call to occur, and it's hard to make this a productive call when the lines are live. Many people have sent in questions ahead of time. We will get to these specific questions in just a bit. If you have a question tonight, there are two ways you can reach out. Number one, you can email me during this call and we will address it. That is katie.donner@ssf.net. We will have someone put that in the chat for you. And if you happen to be joining this call via your computer, there's a chat function. You can submit a question that way and we will address it as well. If after this call a question comes up, do not hesitate to email us at cityinfo@ssf.net and we will respond to your email. Also, all of the questions from tonight will be posted on our website at www.ssf.net. Tonight's town hall features our mayor, Mark Nagales, who will give an update on the city's response to the current Omicron surge. Also joining us is our police chief, Scott Campbell, who will introduce himself and give an update of what is going on in our police department, and Dr. Curtis Chan, Deputy County Public Health Officer, who can address any COVID-19 related questions. I will turn this over to you, Mayor Nagales.
Thank you, Katie. Good evening. This is your mayor, Mark Nagales. Thank you for joining us this evening for a virtual community town hall. Before I get started, let me introduce my city council colleagues, Vice Mayor Flor Nicholas, Councilmember Mark Adiego, Councilmember James Coleman, and Councilmember Eddie Flores, who I believe are in attendance. I also want to thank City Manager Mike Futrell and other city staff for being here as well. As of this morning, 90.6% of South San Francisco residents age 5 and above have received at least the first dose of the vaccine, and 84.1% report are fully vaccinated. For those that are not fully vaccinated or need a booster shot, the South San Francisco Clinic, located at 306 Spruce Avenue, offers free vaccines and boosters for eligible children and adults on Friday and Saturday from 5 p.m. to 8 p.m. I know at times it's been difficult and frustrating to find a COVID test appointment. That's why I'm thrilled to announce that starting today at 616 Linden Avenue, there's a free PCR testing site. From now to this Friday, you can visit 616 Linden Avenue from 8 a.m. to 12 p.m. and get a free test. There will only be 200 tests this week, so please arrive early as it's first come, first serve. However, starting the following week, Monday, January 24th, the hours will be extended to 8 a.m. to 4 p.m. and the site will conduct 2,000 tests daily. I was actually there this morning and the whole process was very easy. Please do your part to end this pandemic and get your vaccine. City buildings and city services are still open and offered. City staff is hard at working every day, continuing to bring our residents the services that you deserve. Some of our departments have had to adjust their services because of the surge. For example, the Parks and Recreation Department has had to postpone swimming lessons, move recreation classes to a virtual format, and adult daycare is closed until January 31st. Council and staff are committed to keeping our residents safe, healthy, and happy. We want to bring all our programs back, but we have to phase them in once it's safe to do so. I want to thank everyone for doing their part by getting a vaccine, taking a test if you're experiencing symptoms, and wearing a mask. I know there's fatigue in all these activities, but we will continue working together and take all the preventative measures. We'll get through this pandemic. Now, I'm excited to introduce you to South San Francisco's newest police chief, Scott Campbell. Our city manager, Mike Futrell, did a nationwide search looking for the most qualified and talented police chief South San Francisco could hire after the retirement of former police chief Jeff Azzopardi. Friends, I could not be happier with the city manager's selection. Chief Campbell has been with the South San Francisco Police Department since 1998. Throughout his career, he has served in different roles, including field training officer, SWAT team leader, patrol sergeant, detective sergeant, planning liaison, and crime prevention sergeant, and patrol watch commander. Wow, Chief, that's a lot. He holds a master's degree in organizational leadership and a bachelor's degree in criminal justice management and an associate's degree in administration of justice, and is a graduate of the Post-Supervisorial Leadership Institute. Chief Campbell, congratulations on your promotion. Let me hand this off to you. Oh, Chief, you're on mute.
Got it. Thank you, Mr. Mayor. I appreciate the opportunity to share this evening. So I've been, as you mentioned, with the city for 24 years. It's been my home away from home. It's obviously a challenging time to become a law enforcement leader, but it's also an exciting time. Lots of transitions coming our way. I fully embrace the challenge, working with partnerships throughout our community to keep South San Francisco a safe and desirable place to live. I know that we don't have all the answers. It takes building trust, working together to identify problems, and ultimately finding solutions as true partners. So I have a lot of goals as the new chief. I'm not going to mention all of them this evening, but first and foremost, our objective is to continue to maintain and rebuild the trust with our residents on the foundation of community policing. We value every community member and strive to meet everyone's individual needs and desires. We are currently evaluating our community relations programs and revamping them to best meet the needs of all of our community members. We understand the importance of transparency and look forward to getting back to these face-to-face interactions with a focus on building bridges with our community. And lastly, really want to focus on recruiting a diverse, educated, and highly trained workforce that mirrors our community and carries out our department philosophy that's built on mutual trust, respect, and transparency. Also, some great news, as many have seen, the new police department, state-of-the-art police department and 911 dispatch center that's being built at 1 Chestnut Avenue. As of today, we are operating out of both facilities and hope to have the entire move completed in the coming weeks. For now, public service is being provided at 33 Arroyo Drive, and we hope to notify the public when 1 Chestnut is fully operational. And once the pandemic slows down, we hope to put another invitation out there to our community members to take a tour of this fantastic facility. Thank you, Mr. Mayor.
All right, thank you, Chief Campbell. Our next speaker is Dr. Curtis Chan, Deputy County Public Health Officer, who is here to address any COVID-19 related questions. Dr. Chan, thank you for being here.
Thank you, Katie, for having me. Thank you, Mayor. Nice to meet you, Chief. Congratulations. I'm really grateful for South San Francisco and all that you're doing. I think your announcements, Mayor, really just highlights all the important work that you're doing. It's key for this pandemic, particularly probably for the next 2 weeks as we're peaking with Omicron. And then we're hoping, as the rest of the country is watching, 2 things happen: gradual decrease in cases and just a little bit more confirmation about that Omicron, how much more less severe or milder it is than Delta. We're continuing to see that evidence come in play. It does cause severe disease, but not quite as severe as Delta. But we're carefully watching that data in an international and national level. And so, but we want to be cautious until we get more data coming through. So, again, the next 2 to 4 weeks is going to be tough. There's going to be a lot of cases, a lot of people needing to isolate, a lot of staff and family members needing to quarantine, doing business, continuity of operations is going to be tough. But we expect more data to come in by mid-February, and things are going to look a lot different in April and May. So I think until then, your messages are really great. When we think about the reproductive number or the R naught or the R effective, we think about those things that you really highlighted at the top of the hour. The first things we do in terms of the R effective number, it's really population susceptibility multiplied by the rate of contacts, multiplied by the probability of infection during contact, and multiply that by the duration of effectiveness. So if people, unfortunately, South San Francisco is not only an industrial city, but a very science-oriented city, you really can be able to figure out what needs to be done from those 4 factors. So for population susceptibility, the most important thing is to vaccinate. And that's what you highlighted. Really congratulations that 90% of the population has at least 1 dose of the vaccine, which is even for Omicron, really, really protective against severe disease. The second aspect is if you want to reduce the number of contacts, the rate of contacts, you want to limit the number of contacts you have. So I really appreciate all the services that cities provide, such as I think you said rec swimming, some of the social services for older adults. I think postponing most of them for the next 2 to 4 weeks is a great idea, but also be poised and ready to provide those services in some virtual way, which I'm sure you're all doing, and then also be ready to get going in 4 weeks. It's not going to be 4 months. It's probably be more like 4 weeks from now. We'll be really able to resume a lot of those services again. So again, that's limiting the number of contacts. That's the L part. For the variable for probability of infection during contact, I usually think of 2 variables for that. One is indoor ventilation or outdoor activities, and the other one is mask to prevent exposure and transmission. So just to highlight those 2 areas, as you know, there's many cities who are offering dining as the weather gets a little bit better to be outdoors. That's a really great idea. Dining that's done outdoors is safe. It can be done very safely, and even dining in which windows are fully wide open can be done quite safely as well too. But it's really important to have indoor ventilation, particularly because of Omicron, because it's so easily transmissible through aerosols. So that's the main concept I would suggest from a kind of a city perspective. And continue to offer lots of outdoor activities too. I think you mentioned your rec and park program. So most of your outdoor activities and facilities, I think as residents, we're so grateful for all those services and making sure that those parks are still open and maintained. Those are safe places to be for both residents and staff. Most of the time, unless you're really very close to somebody for more than a couple minutes, you don't need to wear a mask for those outdoor activities. So the other variable is M for mask to prevent exposure and transmission. And the main update I have for you is that we're getting now the clearest confirmation from the CDC last week that people should wear N95s and KN95s, more basically tighter fitting and more filtration in their masks, particularly in specific scenarios in which you're indoors for extended period of time, particularly when other people are unmasked, so they can't control their sources. So I think Cal OSHA is going to update their guidelines, but I think it's important for residents to know too, those who are medically vulnerable, it's a really good idea for you to be wearing N95 when you're in enclosed environments, such as when you're shopping indoors in a small, poorly ventilated store. That's a really good time for you to be wearing N95. If you're caring for somebody who's ill or has symptoms and you can't isolate yourself from them, you should wear a N95 as well too, or KN95, because that's going to prevent you from getting sick from caring for your loved person. I'm almost done. The I in limit is to isolate if you're symptomatic. So what we're finding from our the three, from multiple of our hospitals are providing some data, is that for adults, most of the viral respiratory isolates that are coming back positive for COVID. So, I think there's not that much flu going around. The not too much rhinovirus, and the RSV seems to be affecting kids more. So if you're an adult and you have a runny nose and a cough, if you can't find a testing site, you should just presume that you have COVID and you should isolate yourself. So more than 50 to 70% of the viral respiratory isolates, depending upon the hospital, are not RSV, it's COVID. So that's a different situation than it was like even a few months ago. Again, if you have a runny nose and cough, you should just isolate yourself for 5 days. You can still get a test to confirm that you're positive. If you don't have any severe illnesses and you've been vaccinated already, if you sit tight for 5 days and isolate yourself, notify other people that you might have exposed them, I think you should be okay. And then you could test at day 5 to see if you want to remove yourself from isolation if the test is negative and you have no symptoms. And the final thing for the acronym LIMIT, so this is the I and the T affect the duration of infectiousness, is that as the mayor highlighted, is to test to confirm infections. So really grateful that you're standing up the Linden site, Mayor, and also the city manager for arranging that. As you know, you hear from across the country, there's testing that's needed because of the surge of illnesses, and also testing that's required because you need a test to leave out of isolation, also need a test to leave out of quarantine as well too. It's a little bit complicated, actually. Much of this is actually done in our public schools already, thanks to the testing contracts that are being set up there, but there's a huge demand in testing. We're grateful for the healthcare providers who are providing testing, but we realize that they're also been overrun with demand as well too. So it's really terrific that both the county and the city are working with testing sites to stand those up. So I think in the next 2 to 3 months, there's going to be a lot more rapid antigen tests and our world is, might be just like run by like rapid antigen tests that we use almost on a daily basis. As many of you heard, the federal government announced today that you can have you can mail from USP, you can request from USPS 4 tests per household, which is a nice start, but I think eventually we're going to need a lot more than that, particularly if there's a strain that's as severe as Delta. So I think I'm going to stop there, and that's I think my points are basically that everything that you highlighted at the very beginning, Mayor, seems to be right on track. Really grateful for the partnership between the city and the county, and let's sit tight and hold things tight for, again, 2 to 4 weeks. And again, I think by April, things will be a lot rosier. Thank you.
Thank you, Dr. Chan. All right, so if you have a question tonight, there are 2 ways you can reach out. You can email me at katie.donner@ssf.net. We will put that in the chat. And you can also submit a question through the chat function on Zoom. So I'm going to start with some questions that we received ahead of time. A couple questions for you, Dr. Chan. Which test should we take if we see we have COVID? It seems like there are pros and cons where PCR tests may take longer but are more sensitive, and rapid tests are faster but don't catch the virus as early as PCR tests.
I'm trying to see the questions too.
Okay.
I have
Please
so
worry
many
about
more
that.
questions for the chief, actually. So, Chief, I'm looking forward to asking you some questions next time. So question, I'm trying to find, I know you said a question, but I want to be able to read the residents. Is it towards the top or did they email you specifically?
This was on the shared doc that I sent you the other day.
I'm
I can
looking at the
resend it
chat.
if you want.
Well, I could just, I heard what you said. So, yes, so rapid antigen tests are not as sensitive as the PCR tests for detecting the virus. So that it's not as sensitive. It's quite sensitive, over 90%. Some studies say like 94 to 97% sensitive. If somebody is symptomatic and having runny nose and cough, particularly with the earlier variants, Alpha and Delta. So yeah, rapid antigen tests are not as sensitive. So I think, for example, if you're going to visit your, mine 87, if I'm going to visit my 87-year-old dad, so I probably would use, and I would prefer using, if I'm going to spend a lot of time with them, use something that's more sensitive, a PCR test, to doubly make sure. I think that would be a safer approach. But particularly if he's not vaccinated. My dad's been boosted now, so even though he's 87, and I can't get a hold of a rapid antigen test. I mean, I can't get a hold of a PCR test, and if I can get a hold of a rapid antigen test, I would then say, well, he's boosted already. That he's vaccinated and boosted. It reduces the risk of Delta by over 90%, just by being of severe disease by 90%. And he's pretty healthy, so the risk is pretty low. And also for Omicron, we're learning that the risk relative to Delta might be around, for hospitalizations, might be something around 70%. For ICU admissions and severe disease and death, it might be 90%. So I think, I might be taking a chance, but I might be saying, well, I'm going to do a rapid antigen test even to visit my dad. So, I think that's a real case scenario for that. The reason why the California Department of Public Health recommends that after you, let's say you become sick with COVID and you test at day 5, they say it's preferred to have a rapid antigen test because it's not as sensitive. It's not as sensitive because what happens is the PCR test is so sensitive. It detects even the smallest bit of RNA particles. Somebody could be positive for 60 to 90 days afterwards. If you haven't taken a really good swab, you might have dead virus and you'll still be positive. So that's why they recommend getting a rapid antigen test and then continuing to wear a mask for a full 10 days. But you could be out and about. If you get a swab, you're negative for your rapid antigen test. That means you don't have tons of virus around. Then you could wear a mask for another 5 days. So, I think I can't reach obviously all the residents of South San Francisco who's wondering the same question. There's many people asking this question. The explanation on the CDC website is pretty good, but that's a little bit of a head start for that.
Great. Well, thank you for that. You actually answered like 4 questions with that one response, so that was perfect. So following up on the rapid test, does the color of the strip indicate how much virus you have? If it's darker, does that mean you are more infectious than if you have a lighter color stripe?
I think there's some good approximation of that. I think that's generally true. If it's very light, it might be early in the phase of the illness, and there might not be a lot of viral particle. It might be how well you swab too. I mean, if you don't really do a good swab, you're just really at the tip of the nose, you might not get as much. But I think if there's any like bit of, if you're using, for example, Binax, like any pink stripe there, that means you're positive. If you have any symptoms as well too, you should just presume that you should have you have COVID. So the short answer is yes, you're right on.
All right, and I'll ask you one more question and then I'll give you a little break. Do vaccinated individuals who catch COVID have symptoms earlier than unvaccinated individuals, and why?
Vaccinated people I have not heard of that. Like vaccinated people having earlier symptoms of COVID. If somebody wants to educate me about that, I have not heard of that. I usually would think they might have slightly, their immune, let's see, their antibodies, their T cells. They usually have less symptoms. They're less likely to have symptoms. They're less, depending upon the strain, 30 to 70% less likely, depending if you're boosted or not, to have symptoms, to have an infection. You're more likely to have a more mild disease. I don't know if you'll be having earlier, which means your incubation period is shorter. I haven't heard of that, but I could be wrong as well too. But it's a good question, but I don't think so. I think you could still think for Omicron, what we're learning is probably the incubation period. So that from the day you're exposed to somebody, you went to a party Saturday, you didn't listen to the mayor or the chief. You went to a party on Saturday, that's day 0. Day 1 is Sunday, day 2 is Tuesday, day 1 is Sunday, day 2 is Monday, day 3 is Tuesday. You're more likely, you're probably going to have symptoms day 2 if your party was at noon. It's like Tuesday at noon to you might start having symptoms on day 3. You can have symptoms up to day 14 actually. So, and that's why the quarantine period previously was 14 days, because you can have the virus could be incubating for 14 days.
All right, thank you, Dr. Chan.
Sure.
All right, Chief Campbell, next one's for you. With the uptick in crime in the Bay Area, this has been the first time that I don't feel safe being out and about. With all the deaths happening and reduced penalties and criminals walking away with no repercussions, how is South San Francisco, along with neighboring peninsula cities, working to keep us safe? You're on mute.
Okay. So the uptick in property crimes is unfortunately a statewide issue and a challenge for all of us. As the chief of police for South San Francisco, I assure you that the decriminalization and reclassification of certain crimes hasn't changed the expectation of our personnel. So we will continue to proactively enforce and hold individuals accountable for their actions to the extent that the law allows. As far as did you mention an attempted kidnapping?
Yes, with female.
Yeah, so as far as the attempted kidnapping, I'm not aware of any recent reported attempted kidnappings within South San Francisco city limits, but I am aware over the last several months, there's been a recent uptick in virtual kidnappings, which has gotten a lot of social media trend I could assure you that South San Francisco has not had any actual kidnappings. In San Mateo County, we do have close partnerships with all of our neighboring agencies. Our investigators work together continuously to address crime. A lot of our crime doesn't just happen in South San Francisco. There's no borders. We have individuals that come from across the bay to commit crimes in our city. So it's critical that we continue to work with our partners to help solve these crimes. And as for the punishments, that's actually determined by the San Mateo District Attorney's Office, as well as the state of California. So at this point, all we could do is continue to do our best here in South San Francisco and make this a safe place to live. And
Can I just jump in here? I think that's an important question. I think for the chief and for the council and for city staff, public safety is our #1 priority. And I wanted to mention there is an issue that's coming up in front of the city council regarding license plate readers. And Chief Campbell, or maybe Mike, do you want to jump in and explain what that is so that our audience is aware of it? And if they're interested in learning more about it, they could potentially participate at the next council meeting and provide some sort of
Sure.
comment about that issue.
Sure. Thank you, Mayor. Next Wednesday at council meeting, city staff will propose to council the purchase of automated license plate readers, which we would place at the off ramps and on ramps at Highway 101, 380, and potentially 280. That will help us to catch bad guys as they enter, our bad people as they enter our city, but also help us solve crime. So many of the property crimes described are not perpetrated by people who live in South San Francisco or even near here, but so-called crews will come over from the East Bay and other cities and prey upon the cities that are on Highway 101 or 280 because of the easy on and off, and they can get away. Other cities are utilizing camera technology. They found it very effective to deter crime and then to solve crime, but it is one step that we plan to take and hope council will take to keep residents safe.
Thank you. Katie?
All right, thank you, Mike, and thank you, Chief. Another question we received for you, Chief, is that a resident has had some interactions with the police department and felt that the police officers' attitudes had some arrogance and was hoping that this will be reevaluated as you are chief.
Sure, thank you for the question. First and foremost, we hold all of our employees, police and professional staff to the highest ethical standards in everything that we do. They are expected to serve our community members in the most courteous, efficient, and professional manner as possible. I also understand that we are all human and can have our bad days, and there's always room for improvement. My desire is for all of our employees to be the best that they can be. And I want to be the first to know if the community members aren't satisfied with our service. For those that aren't aware, we do have body-worn camera technology. All of our personnel have these cameras. They can be reviewed during a complaint process, which allows us to see if there was an issue and to come up with, use it as a learning tool to make us better. And I'd also like to take this opportunity to add that we have there was a recent community survey and I believe 83% satisfaction rate for the police department. So proud of the number. I think we're on the right track. And but like I said, there's definitely always room for improvement.
All right, thank you, Chief. I'm going to turn this back to Dr. Chan. Some questions for you. We all know now that both vaccinated and unvaccinated individuals can get and spread COVID. Is there anything else, such as monoclonal antibody, and encouraging citizens to exercise and stay healthy to maintain a strong immune system, that you are planning to do differently rather than just relying on vaccines? Oh, you're on chat, Dr. Chan, or on mute, sorry.
I think that's a great question. So I think having two things, exercising is a great idea. That's going to lead to a strong immune system, good respiratory system. This is coming on our second year of having COVID now. And, we might see future variants in the future. And what we do know is that people who are really suffering the most and those who've passed away, many of them have had other comorbidities or other illnesses, particularly chronic lung disease. So if you're elderly and it's really important to still be able to go outside and exercise. And I think that's why I made that comment about the parks earlier. Going out there, doing Tai Chi, walking, that's a good thing. If you've been vaccinated already, that's much more likely to prevent death later on than being huddled in your own home, being scared to go outside and exercise. Because you've been protected already by the vaccine. So yeah, having a strong immune system by being strong and exercising, and it's also good for your mental health too. If you've been vaccinated, and again, due to Omicron, the likelihood of you having severe complications is quite low. It's really quite low. So for most cases, you might be more likely to suffer severe injuries from a car accident or traffic conditions rather than catching COVID by taking a walk. So I think that's the gist of that aspect of the question. And, I think there's also more and more antivirals, monoclonal antibodies. There's therapies that your doctor can prescribe to you, particularly if you're unvaccinated, you're particularly at risk. And if you're unvaccinated and you're in a high risk category, you might be very eligible for one of those antivirals as well too. You in San Francisco have Kaiser South San Francisco, really outstanding medical facility. And those physicians can help take care of those issues for you.
All right, thank you. How about thoughts on KF94 mask or surgical mask with a cloth mask when you can't get a KN95 or N95?
Yeah, that's a great question. The KN94s, KN95s from the different countries are all good. I think they may not be great if I'm taking care of a tuberculosis patient inside the isolation room with them in the hospital, which I've had to do many times before. Then you really need an N95. But if you're going to, if you're going to indoor shopping somewhere, or you need to be in an indoor environment to go to whatever office, wearing a one of those high filtration masks should do the job. The information on the CDC website is now 6 pages of scrolling down. There's some nice visuals, and they describe some of those nuances that you're talking about. So, and also talks about double masking as well too. If you could, for example, wear a surgical mask or a procedure mask, and then put a cloth mask over that. So there's 2 layers of the surgical mask and 1 or 2 layers of your cloth mask. If you're comfortable with that, that pushes the procedures or surgical mask closer to your nose, and that should block out a lot of the virus. And I think the most important thing is just to do what's comfortable for you too. It's important that you're wearing a mask, and you're wearing a mask at the right time. Again, I think the reason why I say things like you don't need to wear a mask outdoors is because I don't want to discourage our older adults from exercising outside. Again, having a fall and breaking your hip is something that's could eventually lead to early death and a lot of morbidity. And I think I just want to make sure it's good that people have been concerned, rightfully so. But if you've been vaccinated and boosted, I think we're in a very good position right now. We're becoming to be in a very good position the next 2 to 4 weeks.
Great, thank you. We heard from people taking PCR tests at the county site, Virus Geek, that it's taking a long time for labs to provide the results. Can the county do anything to get the results out faster?
Yeah, the Virus Geeks was very well aware of that problem last week, and they're taking steps to improve that. I mean, I think so much that they closed down. They canceled a lot of appointments this week because they couldn't meet that demand. They were so backed up. A lot of labs are backed up. So the county is working on it. Our team that's working on it, I don't know the details of it, but it's something we're really aware of. And again, that's why we're grateful for the Linden site to be open, I think this today, and then starting higher volume next week. And I think that's also my comment about, if you think you've been infected, just isolate for 5 days. If you have a runny nose and cough and you have RSV, then you either have RSV, rhinovirus, or COVID. I mean, those are pretty much the three viruses that are circulating right now. Not much influenza A or B, not much parainfluenza. Just isolate yourself for 3 to 5 days. It's a virus, so it's a respiratory virus that causes cough and fever. All three of those viruses do something similar. COVID is a little worse, but we're vaccinated for that.
All right, thank you. Does our South San Francisco Event Center and big restaurants have a crowd restriction on indoor dining? And are they checking for vaccination status?
Mike, correct me if I'm wrong, but I believe we're following the county health order on that.
That is correct. We don't have any city-specific restrictions, but we do follow the orders from the county health department.
Thank you.
Great, yeah, thanks. And I really appreciate all these great questions. Like, I'm answering them, but I'm also just thinking about like how we could explain things better on our county websites and what we do for our public information through like Facebook and our social media. So thank you everybody for these great questions. So
And then Dr. Chen, maybe I can follow up. We are offering outdoor dining in our downtown area. And would you recommend as that is something that we continue to do in terms of, for those who want to continue to visit our establishments, in terms of what you're saying, in terms of making sure you're staying outside?
Yeah, I think the overall, I would say that for me, it's not exactly my personal recommendation, but what we could predict from public health is that this is going to be a strategy that public health is going to emphasize across the state and nation, that it's much more safe to be outdoors for all activities. Dining is one in which you're removing your mask. So I think it's a good reason to not just for your not just for Grand Avenue. I mean, there's a lot of traffic that goes through there, but I think that's kind of the future that we can envision. We're saying the same things through Superintendent Nancy McGee to all the districts superintendents. I think next year, I think there's going to be even more emphasis on outdoor lunches and those picnic tables. I know many schools did order them for this year. There was a high demand and not enough supply for them, but just because that's the environment in which people are unmasking. But again, like if people are not boisterously like enjoying dinner or having a nice conversation, a date with a few people, or a date with like a little quiet dinner date, those are things in which the risk it won't be that high. And again, in maybe 4 weeks, we're at like over 1,000 cases per day right now in the county. It's just a lot of cases right now. I mean, we were at like 10 cases a day in like October, and now we're 1,400 cases a day. I mean, that's how much virus is in the community. So, but we do expect that it's going to drop very quickly, and at that time, so order takeout from your favorite restaurant for the next 2 to 4 weeks. then after that, I think it's probably going to be much safer to go back inside restaurants. I do like your point about outdoor restaurants. It's something that public health will most likely emphasize across the state.
All right, thank you, Dr. Chan. Okay, I'm gonna give the mic to City Manager Mike Futrell and Police Chief and the Mayor. How are cameras near 101 or 280 be a good way to deter criminals from committing crime in our city when California law seems to protect criminals more than law-abiding residents? Is there anything that you are doing to push for changes so that criminals will be held liable for their actions?
Well, I can certainly answer the first part of that. On the deterrent side, our neighboring cities are also putting up cameras. San Bruno already has their cameras in place. And I don't think we should be the only city without cameras, because I think that would attract criminals to a place that's not as protected as other cities. So we will certainly publicize widely that we are watching, that we are vigilant, that we have cameras. And if you come here, we will capture your vehicle on camera, and we will do our best to apprehend you. So through that, we do hope that they'll move on to some other area that they might think is less vulnerable than South San Francisco. As to what the state legislature has done over the years, I know there is frustration that certain property crimes you catch and you give them a ticket and then they release. That is not something that is in the city's control, the mayor's control. That is in Sacramento, and not really something I can speak to, except I have and do understand the officer's frustration when they do catch individuals and then the law says you give them a ticket and they go about their daily lives. So Chief, I don't know if you want to add anything or Mr. Mayor to that, but I do think the cameras will add to our suite of activities that we're doing to deter crime before it even happens.
Let me just say, so council gets a report every night in terms of activities that happen throughout the city. And there is one instance, and Chief Campbell, I know there might be still an investigation about this, but where we were alerted because of the cameras of a suspect. And that we found out later on that the suspect actually was involved in a shooting in San Francisco. I don't know if you can talk about that or an example of how the cameras in other cities have alerted us of potential individuals might be committing a crime or trying to get through our city. I wonder if you can talk a little bit about that in terms of.
Yeah, absolutely, Mr. Mayor. Of course. So we have seen a number of success stories based on our neighboring cities having the cameras. The one you mentioned of was we were alerted to a San Bruno camera that a vehicle was entering South San Francisco. One of our officers spotted the vehicle. It was a car full of individuals armed with handguns that were wanted for a armed robbery that happened in Sacramento with shots being fired, as well as a robbery that happened in San Francisco. We can only assume that they were in South San Francisco to do similar activity. Based on the cameras, we were able to safely capture all three of these individuals and take a loaded firearm off the street. And that's just one of many examples that we've had over the last couple months.
Thank you.
Thank you all. What plans are there to address the homeless problems and the motorhome parking problem associated with the homeless, such as on Shaw Road? This issue has attracted abandoned vehicles with a tremendous amount of trash near the overpass, which can't be positive for the neighborhood and property values.
Thank you for that question. South San Francisco has really done an amazing job of working with homeless individuals over the last few years. It wasn't a few years ago when we had a count of 177 homeless individuals living outdoors in South San Francisco. The most recent count, that's down to 34. And that is because we have a joint team that works every day with mental health professionals, with medical professionals, with police, to go out and work with individuals to find housing, to find the mental health help they need, substance abuse help. And we've had some great success stories of helping people recover their lives, get back into housing. As to the recreational vehicles, we do enforce that there is no overnight parking, and we work with those individuals in a very humane and compassionate way, but we do not allow overnight RV parking and people to basically set up a home on the side of the road in South San Francisco. So Shaw Road has been an issue, and that is because it's out of the way, it's out of mind, and you have to make an effort to go down and check that. So, but we have a lot of success stories with our compassionate approach, which is consistent and offers a full suite of services that's shown to be effective. So, Chief, I don't know if you want to add anything about the RVs and Shaw Road and issues there.
Yeah, it's been a challenge over the years. We do our best to address it. The main thing is if someone that works in that area, if you do see the problem, please call us. Our non-emergency line is 650-877-8900, or you can email webpd@ssf.net, and we will have the issue addressed as soon as possible.
All right, thank you. Back to you, Dr. Chan. If regarding county data, if someone tests positive on a rapid test, that counts as a positive case. If the same person later tests positive on a PCR test, do they get double counted as a case?
It doesn't, most of our rapid tests that you do from the over the counter doesn't get counted as part of our case. If it's reported to us, we have an official way for us to know. It's usually in these last several days, like 200 to 300 more than the PCR tests, but it's typically not double counted. The problem is really the reverse. Actually, there's many people that we think are actually being infected right now who are not getting PCR tests at all. It's just so difficult to find right now, despite the extraordinary efforts of our healthcare partners and our county. So we do recognize, I think maybe the community members asking about this. Yeah. So there's some underreporting, and there's a lot of underreporting. Maybe a few cases of overreporting. Yeah, one individual could test one day and decide to test the next day too, or in 3 days, and that might be double counted. But yeah, there's definitely a huge problem of like COVID cases right now.
All right, thank you. How is the county handling vaccination of the homeless?
Yeah, I saw that question there. I think one really key thing that I appreciate Carmi asking is how does the city and county handling vaccination of the homeless? And I think that's just a really important point that I think maybe Carmi is making. This pandemic is a really good opportunity for collaboration across agencies, all the cities, all the departments in the cities are really working with the county to address the pandemic of COVID, the pandemic of stress, the pandemic of poverty, of depression, feeling of isolation. So I do really appreciate that you highlighted city and county, and the county agencies aspect. That it's not just the health department; it's human service agencies. It's public works that's really putting together the mass vaccination sites. It's our county manager's office. It's really basically all hands on deck. And so specifically for the homeless situation, for example, it's working with the social service agency. We had early on in the pandemic, as you might remember, in the earliest phases of vaccination prioritization, we prioritized vaccinating the homeless first, and it was actually one of our clearest strategic plans, and it was to vaccinate the homeless. It was through our healthcare for the homeless program that we were able to work with people who are street homeless, as well as those working in the shelters. So I think it was really one of our most robust efforts. Still, I think there's still a lot of room for improvement of everything that we've done, but I appreciate you asking. So, and I think there's continuous opportunities for people who are in the shelters to get vaccinated as well too. So this was a huge issue also, yeah, throughout the Bay Area, that we wanted to make sure that there weren't large outbreaks amongst the street homeless early on in the pandemic, and we've prevented a lot of that. Recently, because of Omicron, there's been outbreaks in the shelters, and the shelter staff and the county staff have done a tremendous job trying to protect people who are in street shelters. There's been so we've been hard at work at doing that work. Many of those people have been vaccinated, but because Omicron is so contagious, that people are still getting infected with mild symptoms as well too. So thank you for that question. It really does highlight much of the collaboration that's being done in the county.
All right, thank you, Dr. Chan. I'm going to ask one last question for the mayor. Can you please repeat the city's vaccination or testing site at Linden, or the days and hours?
Sure. So again, it's 616 Linden Avenue. And so from tomorrow, Wednesday through Friday, the hours are from 8 a.m. to 12 p.m. And they're available to do about 200 tests a day. And there's no appointment needed. You can just show up, but I would recommend going early. And then starting Monday, January 24th, I believe it's the date for Monday, then we're going to expand the hours from 8 a.m. to 4 p.m. And they'll have the ability to do 2,000 tests a day. Thank you for that question, Katie.
All right, thank you, Mayor. All right, so we have more questions to answer, but we will be uploading those on the city's website, and we will answer all the questions that we received. So the recording of this town hall and all the Q&A will be posted on our website, www.ssf.net. We will make sure to send an email out to all residents when that is posted. So make sure you sign up for our city email updates. You can also find that on www.ssf.net. Before we end this meeting, I'll turn it back over to Mayor Nagales for some brief closing thoughts.
Thank you, Katie, Chief Campbell, Dr. Chan, for being here, as well as everyone on this call. One of the most comprehensive ways you can get the latest information from the city is by signing up for a weekly update. Please send us an email at cityinfo@ssf.net, and we'll get you on the list. Please don't hesitate to reach out to us. I, along with the city manager, the police chief, the fire chief, and the emergency services coordinator, are on multiple calls weekly with the county, state, and the national officials. And we are here to answer any questions you might have. This was my first town hall as your mayor. I hope that you found this information informative and helpful. While the original plan was to do this in person, I know there will be many more opportunities to connect with you. In fact, later this month, I will be co-hosting another town hall with Senator Josh Becker. More information to come. Friends, I just want to say have a great evening and please stay safe. Thank you. Good night.